can you use the X39 while on chemo?
Yeah, so as you know, we can't make any medical claims. We have not performed a clinical study on the use of X39 on people that are suffering with cancer. We were very fortunate to work with a medical doctor at Gemelli Hospital in Italy using our glutathione and energy enhancer patches. And this oncologist specializes in breast cancer. And so what we were looking to do is help women recover from chemotherapy and radiation. And he said that these were the best products that he had ever seen in terms of how quickly women recovered. So they had tried all types of products, natural products like ginseng and so forth. And he said when people use the energy and glutathione patches, they would have more energy, less nausea, they felt better, faster, sleep quality returned, these types of things. So if someone was interested in using X39, first they'd have to inform their oncologist. Most oncologists don't want people on any type of antioxidants or other supplements when going through chemo. So they might have to use it after the chemo. And by the way, you know, I personally don't believe in chemotherapy. I don't even think it's named properly. And there's many other effective therapies like ozone therapy, which are wonderful as a base therapy for treating cancer.
Okay, and so it leads right into the next question, because there were probably 6 or 7 questions that came up specifically about breast cancer protocol. I know that is something that's very dear to you as well, I believe because of your mother. So
Right.
They asked, what would be the best breast cancer protocol was one of the questions that came up.
So it was probably a good opportunity to say that I'm not a medical doctor, and so any recommendations, they should take that to their doctor. So first thing is, if a woman has breast cancer, my recommendation is you start from the foundation and build up and take a look at what could be the potential reason as to why the cancer developed in the first place. Was it from having a poor diet? Was it from, you know, smoking, excessive alcohol, drug use? You know, if it's possible to pin down and identify what the cause could be, that, you know, that would of course be helpful, but it's not entirely necessary. So a couple things. When it comes to diet, one of the things that's coming out now is that ketogenic diets are very, very useful at starving cancer cells. So in other words, cancer cells thrive off of sugar. So if we go to a diet that's about 80% fat, 20% protein, the cancer cells now don't have fuel to reproduce. So there's very good research showing that ketogenic diets can be used as a way to be therapeutic as a treatment. The next thing that I'd be looking at is ozone therapy. So basically what happens is there's about 75 to 200 mils of blood that's withdrawn from the body. The blood is then exposed to ozone gas. It forms ozonide compounds. Your own blood then is injected back into your body. And now these ozonide compounds will act as an agent to directly destroy cancer cells. And it's important to know that when someone has a healthy immune system, they produce ozone and other oxygen radicals like peroxide that directly destroy cancer cells. So in fact, this is a way to augment the function of the immune system with something that's completely safe, completely non-toxic, and something your body produces anyway. Many people can be completely cured of cancer just with ozone therapy. Then there's other agents that can be used, natural compounds such as selenium, which about 800 micrograms a day, has very powerful anti-cancer activities. It can kill cancer cells on contact. Extracts of garlic contain a organic mineral known as germanium sesquioxide. It's called Ge132. And Ge132 was discovered in Japan as a naturally occurring organic semiconductor, and it prevents cancer cells from reproducing. So you go through, as an example, you met a doctor in Mexico once. He was using garlic juice and glutathione and had about an 85% success rate at treating cancer. So after about 3 weeks, the cancer cells are no longer dividing, the immune system is built up, and the immune system can destroy and attack cancer cells. Colostrum. There are a number of natural components in mother's milk. And so colostrum, there are maybe at least 4,000 clinical studies that show that compounds in colostrum have very powerful anti-cancer effects. So that's something that can be used to build up a person's immune system. You know, we could spend 2 hours kind of going through the list. But one thing that a woman would specifically want to look at is estrogen metabolism. Typical drug that women go on is Arimidex, which is relatively safe. And the idea is you first get the estrogen metabolism under control. A mild aromatase. There are mild aromatase inhibitors. Their natural DIM is one, which is found in broccoli, which is okay. And we found through our own research, and I'm not making a claim about our patch, I won't say how we did it, but we took a group of 6 women. We did a study and used medical infrared imaging, and they were in a pre-cancerous state. So in other words, their breast tissue had vascularized, and the cancer cells were forming a network of blood supply to form a tumor. What we did was we elevated their glutathione levels, and in a period of about 3 months, that vascularization disappeared and the tumor never formed. So I would recommend that a woman go see a medical doctor about getting regular IV drips of vitamin C and glutathione as a minimum. Very inexpensive. Do it twice a week. And then alternatively, if you can get it, IVs of curcumin and DMSO. They're both very powerful anti-inflammatories, and they're good for all types of cancer. So, you know, bottom line, I know the word cancer can be really scary, but there is an abundance of natural, safe, effective, affordable compounds that are incredibly effective.
And and you must be reading my mind because you did right through the next question, which is perfect. Is there a patch protocol that you would recommend?
Yeah, so any research that we might have done with patches and cancer, I can't talk about, because then I'd be making claims, and then you know, we'd have issues with the FDA. So I can't recommend specific protocols. If people wanted to use the patches that way, they'd have to speak with their doctor. We believe the patches to be safe, even when people have cancer. And if they wanted to use them as a protocol to help support their energy, their vitality, support immune health, they could do that, but under a doctor's supervision. So products like X39 and Eon specifically would be really good at supporting general health.
Okay, thank you.
光线是自古就有的一种可追溯到时间之初的能量形态。对我们来说，光线都始于整个太阳系的光源和生命之源太阳。甚至爱因斯坦也断定，我们的所有构成成分都包含光线。所有生命源于太阳的光合作用。植物和植被收集光线，所有生物都发出光线。实际上，人类发出可利用夜视设备看到的红外光。数百年来，众所周知，光线对人体有许多影响。LifeWave 的光疗贴片使用光线刺激人体的自然痊愈系统， 为身体健康带来诸多特殊益处。这里列出了这种科技的工作原理。首先，将一个贴片敷于身体特定穴位上，贴片覆盖的皮肤部位发出红外光，反射到身体组织中。皮肤受到刺激，反过来又刺激人脑的特定区域，从而让人脑充分发掘出人体自身的自然能量流和自愈潜能。让我们看一下这在细胞层次为何重要。例如，我们的许多贴片产品有助于抵消自由基，自由基破坏细胞蛋白质的氧分子，从而加剧老化，产生明显迹象。人体经过光疗法刺激释放抗氧化剂时，这些自由基被自然中和。LifeWave 光疗贴片促进优化身体修复力的环境，从而产生诸多特定健康益处，绝对不利用有害药物或化学品。所有这一切都有助于人体保持健康年轻状态。如需了解详情，请联系经销商或访问 LifeWave.com。LifeWave， 长寿生命，健康生活。